A single unit of blood goes a long way. A pint of the so-called red gold can save up to 3 lives. That's the message doctors at the University of Chicago Medicine are trying to spread because the need for donors is important now more than ever.
So may I look at both your arms? Good. Take a look at the vein. You have great veins.
We have enough of it running through our bodies.
We can artificially make a heart more than you could make a blood. So every unit that goes into a patient has to come from somebody.
Enough to save lives.
I'm saving somebody's life by donating. Please donate.
With a new trauma center and the expansion of the emergency room, officials at UChicago Medicine are running low on a critical life-saving tool, blood. And it's the smallest of us that need it most.
So one big shortage that we have is we're looking for O-negative blood for our premature neonatal infants, right? So their immune system is sort of out of whack and they're very sick.
Dr. Chancey Christensen, who oversees the blood bank, says the focus has primarily been on premature babies, but there's another group that gets hit hard when blood runs low, patients with sickle cell.
Sickle cell is primarily an African-American disease, and so what we found is that there's a lot of better match if the donors that they get their blood from are of this similar ethnic origin.
Doctors have found the shortage is even more dire among people of color.
A lot of people donate, and they only donate once a year, and so they're like, okay, I'm good, but it's like, it's not good for a year, it's good for like a little over a month. We can't refrigerate them, and so if they're more than 5 days, they become a risk of bacteria, and so that's why we're always short.
Weta Colbert has sickle cell anemia SS, the most common type of the disease that causes a constant shortage of red blood cells.
Painful. A lot of pain.
Memories of Colbert's childhood are tainted because the disease prevented her from living an active life.
If I got cold, I couldn't play like with the other kids in the snow. And it was kind of hard for me to walk home from school in the cold, in the elements. Because if I did, I would get sick.
Colbert visits the blood bank once a month. She credits her faith for keeping her alive and says she's thankful for the sacrifice donors make.
Because you're saving a life. And you've helped save mine.
Jennifer Gilbertson is a regular donor. She's been donating blood since high school.
I just feel like it's my responsibility as a healthcare provider and just an individual to give back. I'm healthy and I see a lot of people in the hospital on a daily basis that aren't.
And Dr. Christensen says someone needs a blood transfusion every 2 to 3 seconds. That's why it's so important to donate regularly.
O and A are the most common. B and AB are a lot less common.
If you're over 18, weigh more than 110 pounds, and maintain a healthy lifestyle, you're the perfect candidate.
So you continue to squeeze throughout the blood donation.
Putting yourself in someone else's shoes that isn't so lucky is what I would encourage people to think about and feel when they're thinking about giving blood.
You're saving somebody's life by donating. Please donate.
If you want to go ahead and donate, head over to UMedicine Chicago's blood bank website. You can call or make an appointment, or you can just go ahead and walk in. Now, their hours are Monday through Friday, 7:30 a.m. to 3:30 p.m. Now, the hospital is huge. Just make sure you type in that address that you see on your screen so you're taken to the correct building.